How was fluoride affecting Manhattan Project workers?
Sad is that all the workers who were working on this project began to get ill, and they were trying to figure out what was the cause of why they were getting ill. So Harold Hodge, very smartly, was running some experiments to try to figure out what was causing it. Well, his results were that it was the fluoride. So, but once he became the spokesperson, and I don't know how that happened, to be honest, how he became the spokesperson for it, it was too late. That bandwagon got rolling. There was the PR through Ed Bernays. It was almost like the whole smoking campaign. They made it seem like it was a good thing. And once that bandwagon got rolling, it was too late. But a real cool story about Harold Hodge. Fast forward from that to almost 50 years later. Now, Harold Hodge died, I think, around 93, 94, something like that. But in 1990, there was a scientist, Dr. Mullinex, who was doing a study on sodium fluoride, which is what's in our toothpaste, and rats and how it affected them. And she came up with this new process where you could watch the rats 24/7, so you didn't have to keep checking on them. And what she found at the end of the study was that their IQs were dropping. They were getting very, very confused as they were in these mazes.
Really?
So she presented those results, and they basically said, no, that can't be right. Go do the test again. So she runs them again, gets the same results. Well, she told me the story personally on the phone. As she was on her second round of tests going through this, Harold Hodge was in the lab. It was at Harvard. And he looked over his shoulder and said, what are you working on? And she said, oh, I'm working on this. And he goes, I got the same results.
So Dr. Harold Hodge was intimately involved in the making of the nuclear bomb. Fluoride was necessary to make that nuclear bomb. When workers got sick, he investigated and found that fluoride was the cause. And the end of the story is that he ends up being the promoter of water fluoridation. That is amazing to me, that the person who knows how dangerous fluoride is ends up supporting adding it to our drinking water. Oh, here's a clip of Dr. Harold Hodge from the 1950s telling the American people that it is safe and effective to add fluoride to your water at 1 part per million.
The book looks very hard at the role of a key scientist, Dr. Harold Hodge, in the fluoride debate. Dr. Harold Hodge, for most of the Cold War, was the leading scientific defender of the safety of low doses of fluoride and the beneficial effects of water fluoridation.
Dr. Harold Hodge, a distinguished toxicologist on the Rochester team, has carefully investigated the safety of fluoridation.
Well, to put it very simply, fluoride is safe at 1 part per million.
No scientist's word was trusted more by the health establishment than Dr. Harold Hodge when it came to fluoride. He was a very senior figure and operated at the highest levels for almost all his scientific career.
This brings us back to the fundamental point. Fluoride is safe, and I think I can say in conclusion that there is no health hazard that justifies postponing water fluoridation.
So there you saw Dr. Harold Hodge telling the American people that we need to add fluoride to our water immediately. What I find really interesting is that when he's telling people that it's safe and effective at 1 part per million, he has 2 throat clears. It's almost like he's unable to maintain his composure when telling the American people this massive lie.
Fluoride is safe at 1 part per million.
It's sort of a random number. I honestly don't know how they came up with the 1 part per million.
It sounds good, right?
Sounds
It
good.
can't be that much. It's just 1 part per million.
But here's the problem with that, Rob, is you can't control the dose. If I drink 1 glass of water, fine, I'm fine. But Rob, you may drink 8 glasses like we're supposed to. Then you got way more than I did. What if you're 5 years old and you're drinking water? What if you're a baby that's being fed with infant formula where the predominant part of their diet is water? That's the whole issue, is there's no dose. You can't control it. And that's when this becomes a drug that you're being force-fed.
Cole, you mentioned the idea of fluoride being medication. Let's talk about that a little bit more. Libertarians who oppose water fluoridation, they say that it amounts to forced medication because those who drink the city water must ingest this medicine, and that governments do not have the right to force the citizens to consume a medicine. What do you think about that argument?
Well, I agree with that. I mean, I think that if you look at all the things they add to water to make it safe, that's why they're doing things like, adding the chlorine and adding things like that. It's to make it safe to drink. It's not to medicate. Fluoride is the only thing that's added because of a government mandate to our water. It has no other function except to provide us with the so-called anti-cavity action. So I agree. I think that we should have the choice to choose that or not. If you really think fluoride's great, good. Go buy toothpaste that has it. Get supplements for all I care. But you shouldn't have it in your drinking water.
That strikes me as very interesting that fluoride supplements are available very cheaply. So if you want to ingest fluoride, you can easily do that. Yet governments who support fluoridation don't even take that into account when mandating that every citizen who drinks the city water consume fluoride, whether or not they want to, even though the choice to buy fluoride for ingestion is readily available. Doctor, I wanted to ask you, how have the rates of dental fluorosis changed since you've been practicing dentistry?
As a dentist, I can tell you that 10 years ago, I probably saw one case of fluorosis once a year, maybe once every 6 months, 10 years ago. Now, Rob?
So 2000.
Yeah, even 2000, let's say.
One case?
One case every 6 months to a year.
And how many patients do you see?
Probably see about 35 a week, maybe more.
Just so we're clear, Doctor, you have a completely full practice. Is that
That's
correct?
Right. That's correct.
I can't even get in to see you.
That's right.
You're just booked solid.
Booked solid.
So you're doing something right in the dental world to get all these repeat clients.
I'm very fortunate. But here's my point, Rob, is that I hardly saw cases of it. I mean, I saw some bad ones, okay, and I've treated them over the years, but now I would say I see one a day. The new stats are, and this is through government studies, not through any off-the-wall studies, 41% of adolescents now have some form of modeling on their teeth. 41%. 2 out of every 5 kids now have this, okay? This is a problem. This is an epidemic. This is a pandemic. And the one thing that I have to point out, because mainstream dentistry will tell you, big deal, it's just a cosmetic effect. This is how they always downplay it, is that the government is lowering it because they're saying, you know what, we don't want to see ugly teeth. Rob, I got to tell you that when you see it on the teeth, that's the final visual effect of it, okay? It's already in the body. Who knows what it's done to our bones, our kidneys, etc. Just to see in the teeth, that's not just a cosmetic effect. That's your body saying, look, there's something going on.
What's really upsetting to me is how proponents of water fluoridation in the government dismiss dental fluorosis as only a cosmetic effect. The point of the matter is that the government is sponsoring a program that does damage to citizens and affects the way they look. And what is more important to Americans than the way our teeth look? We spend thousands of dollars on dental care to try to prevent cavities, on braces and orthodontal work to get straight teeth. I mean, today, if you don't have straight teeth, you're almost looked at as if something's wrong with you. This was not the case 20 years ago. But now, almost everybody has some orthodontal work to get those perfectly straight teeth. And we spend lots of money on whitening for our teeth. There's those Crest whitening strips. You can get whitening toothpaste. We spend so much time, effort, and money trying to get our brightest, whitest, straightest smile. And for the government to sponsor fluoridation, which they know causes a staining of the teeth, and for them to dismiss it as just a cosmetic effect, that's just appalling to me.
Yeah, and it is very costly to fix. And I got to tell you, this is something that nobody ever talks about. As a dentist, when I'm drilling on a tooth that has a cavity, it's a finite procedure, meaning I can see the decay, I can feel it, I know when to stop. When you're working on a teeth that has this kind of modeling on it, you can go all day, meaning you don't even know where to stop sometimes. This stuff goes all the way through to the inner part of the tooth. As a dentist, you just got to kind of stop at some point and say, I'm going to make my line here, and I'm going to cap this or put a veneer on it. It's kind of scary because you're not really cleaning everything out. You can't. That's the whole point. It's so through and through. And that's scary to me because I lose control at that point. I mean, I don't know what to do. It's that brittle. It's unbelievable.
This is one of your specialties, is that right, Dr.
I do a lot of cosmetic work, and that's the one time when I feel a bit out of my league because it's sad to me because most of the people that I see who have this problem are adolescents who are now ashamed They don't smile. It really affects their whole life, as you mentioned. And it's sad because not everybody can afford $30,000, $40,000 to rebuild their mouth. That's a lot of money for anybody. And so to try to just cover it up.
I'm sorry, $30,000 or $40,000?
If you do a full case, if someone's got all their teeth affected and you got a crown and do veneers, it's between 30 and 40 grand.
You've done that on adolescents?
I've done a few cases.
Oh, goodness.
It's a lot of money.
Now, if each one of those teeth had a cavity, what would it cost?
Oh, a lot less because you'd be doing filling. So let's just say they had a cavity on all 28 teeth because most people don't have their wisdom teeth or whatever. It might be, a couple hundred per tooth. So do the math. It's a lot less. Right. And they always make the argument that we're trying to help the underprivileged, okay, who can't afford to go to the dentist. But I say
it's a great argument, isn't it? We're helping poor people.
I
How
say
can you not like us?
Yeah, and I say it's just the opposite. I say that underprivileged cannot afford to drink spring water, okay, or get an RO system, so they're forced to drink tap water. I think it's just the opposite.
RO system. Can you tell me what that is?
It's a reverse osmosis system. They're not cheap. That's the one thing about fluoride. It's a tiny molecule. You can't filter it with a Brita machine. You can't filter it with your basic tap filters and all that. You got to have reverse osmosis. And even that, Rob, will at most will get out 85% of the fluoride. You can't get it all out. It's impossible. It's that tiny of a molecule.
Brita is America's #1 water filter. I recently bought one. I looked on the back, and it says removes, contaminants, but leaves in, quote, a healthy level of fluoride. It almost seems like Brita is part of the pro-fluoride propaganda, telling those that buy their product that fluoride is good for them. Changing gears a little bit, Dr. Cole, can you tell us a little bit about the chemical that is used to fluoridate our drinking water? Now, I know on our toothpaste it says, active ingredient sodium fluoride, do not swallow. To me, that signals that I shouldn't be swallowing fluoride at all. Yet we add it to our water. So can you tell us about what is added to our water and how that differs from sodium fluoride?
Silicic acid. Sometimes it's called hexafluorosilicic acid or just a fluorosilicic acid.
It sounds like a very scary molecule. Calcium fluoride sounds like it might be a nice little happy molecule that's doing stuff for my teeth and bones there. But fluorosilicic acid sounds very scary.
It's a byproduct, as I mentioned, from the phosphate fertilizer industry, also from the steel manufacturing industry as well. And Rob, this stuff is so toxic that the EPA does not allow it to be dumped in landfills.
So when we say byproduct, do you mean an actual waste product?
I would call it a waste product. Some people argue, well, a lot of things have byproducts that are used for other purposes, and that's fine. Let's just call it a byproduct for now. But if it's so safe, why can't we put it in landfills? Why do we got to be very careful with how we handle this? Why is it handled in toxic trucks and all this? I mean, why?
So doctor, you're telling me that the chemical added to drinking water to increase the level of fluoride is so toxic that it can't be disposed of in a landfill where my trash and waste products and dirty needles and all that nonsense goes. It's too toxic for the landfill, but it's clean enough to be put in the drinking water supply?
More with Dr. Griffin Cole coming up.